What's up, guys? Doc Brown here. Another video. I'm gonna cover anaphylaxis and seasonal allergies today. I'm gonna start off with types. You have your contact. You got your plants, so your poison ivy, poison oak, and sumac. Some people are allergic to latex. That's why we don't use latex gloves. Animal dander. And some people are allergic to jewelry. I've seen mostly pewter allergy for jewelry. Some people just don't like it, I guess. You can adjust things, so eating or drinking, milk, medications, nuts and shellfish. The milk, I think, would be more of you're lactose intolerant kind of a deal. Nuts and shellfish, it's kind of the stereotypical one. Injections, so your bee stings, and again medications. Inhalation, so you're breathing it in. Pollen, dust, mold, mildew, animal dander. We'll see a lot more of this in the spring and early summer with your seasonal allergies. So your seasonal allergies, you're going to have some clear drainage. Your nasal mucosa, so the lining of your nose, your nostrils, is going to be inflamed. In drier environments, such as like if you go to Arizona, for example, your mucosa can dry out, and that's what gives you the nosebleeds. You can have nasal congestion, complaints with or without either or. Red watery eyes, sneezing. Your temperature is going to be normal, and we're going to fix that with some Sudafed. Y'all can't really get that unless you go across the river to Washington, because here in good old Oregon it's illegal. They just had the fake stuff on the shelf, but we're going to use Sudafed, 60 milligrams. This stands for perm osseous, I think is how you pronounce it, but taking it orally. The Q on these stands for every, and you're going to take it by mouth every 4 to 6 hours as needed. Benadryl, you're going to take 25 to 50 milligrams by mouth every 6 hours. That is only if you're in a tactically feasible position. So out on the range doing gunnery, probably not a good idea. Driving, not a good idea. You're doing some night ops downrange, definitely not a good idea. You're going to want to hit more of the Sudafed. And then with most things, increase your water intake. Water fixes a lot. So over on your anaphylactic side of things, we have some considerations. Anaphylaxis can happen within just a couple minutes of being exposed to whatever gives you the worst allergies. Primarily, this comes from insects, medications, and food. Insects, that is pretty much any insect bite, whether it's a bee or maybe a praying mantis, all the way up to like your water type bugs. Death can occur from airway compromise if not treated quickly enough. And your medic, me in this case, if you're here in Delta, will be teaching you and supplying you with an anaphylaxis kit and making sure you know how to use it. Luckily, here in Delta, we don't have too many people with allergies, just more along the seasonal types, which is easily managed. And again, anaphylaxis is a life-threatening issue. I forgot the E on the life, so forgive me there. So what are we going to do to, before we do that, let's go over to signs. Signs and symptoms, we're going to have wheezing, dyspnea, I'm sorry, I can't talk. Basically shortness of breath. Stridor is a high-pitched sound when you're breathing in. Angioedema is swelling with no pain attached to it. So if you think of somebody with cardiac issues, they can have their legs swell up. So if push in with your fingers. On me, on a healthy person, you don't have any marks there. But if you on somebody with angioedema or something like that, you push in, and it's kind of like memory foam. Your fingerprints are going to stay there. Hives, that's kind of looking like a rash. They're typically red. Hypotension, so low blood pressure, and tachycardia, high heart rate. Moving into management, we're going to use epinephrine. All of us medics carry EpiPens, at least one of them. I think I have 2 right now in my aid bag. But if you are one of those people that does have a reaction to something, so like bee stings, is going to put you into anaphylactic shock. If you don't have an EpiPen, go see your doctor and get a prescription for one, because that is something that you're going to need both militarily and just in everyday life. It's always a good thing to have and carry or have close by. If we don't have an EpiPen and we're just drawing it out of a vial, we're going to use 5 milligrams, 0.5 milligrams, or 0.5 milliliters of the 1 to 1,000 intramuscular vial. I know some of you infantry guys don't really care about that, but for the medics that will watch this, that's what we're going to use. And then we're going to repeat that every 5 minutes. For you non-medical folk, PRN is per nursing, I think, but basically as needed. Something everybody can do is throw a pulse oximeter on, so you're going to keep an eye on their oxygen levels that's attached to their blood. I'll go over that in another video. Have a BVM available. Bag valve mask is what that stands for, and an NPA, nasopharyngeal airway. People that are going into anaphylactic shock lose their airways, so throwing in an NPA, if you see some of these signs and you don't have an EpiPen, or it's on its way, it's just coming slowly, throw in an NPA, and that's going to help them keep an airway open. If you don't have any epi whatsoever, we're going to intubate very early, so that way we can maintain an airway. Because again, like we mentioned up above, death from airway compromise is why we need to intubate very quickly. We're going to establish an IV. Infantry guys, you can assist with that by getting the bags ready and whatnot. We're going to use normal saline. That's what the NS stands for. We're going to use 1 to 2 liters for hypotension. So if they've got a low blood pressure, we're going to use normal saline. And then, like over on the seasonal side, we're going to use some Benadryl, 50 milligrams, and we're going to administer it through your IV, intramuscular, by mouth, or SL is sublingual. Whichever one of those that you have, use it as early as possible. Then we're going to use Decadron as well. If I remember off the top of my head, it's a steroid, so it's going to help keep your breathing more stable. We're going to use 10 milligrams IV, IM, or PO. If the person is still wheezing after you give epinephrine, we're going to consider some albuterol treatments, 2 to 3 puffs every 5 minutes, up to 3 times. If we have the ability to do like a duo-neb or any kind of nebulizer treatments, that might be a good idea as well. And the book says take Zantac, 150 milligrams by mouth. I'm having a brain fart on what BID stands for. I just looked it up. I'm sorry, guys. When I post this, I'll type it in the comment section. But I'm not 100% sure why the Zantac is something that the book suggests. Typically, that's for like stomach issues, like heartburn. But yeah, that's your allergy video. Hope you guys enjoyed. Oh, and it's an urgent evac. I'm kind of a space case today. Apologize about that. All over the map. But enjoy your evening. Freedom on, guys.